Bismillah ar-Rahman ar-Rahim. Our case today very interesting. The history, antenatal history. 40 years old mother, gravida 4, bara 3, known case of diabetes and hypertension on insulin and antihypertensive medications. Positive consanguinity. Perinatal history, outcome full term 40 weeks, normal spontaneous vaginal delivery. Postnatal examination, the baby looks like dysmorphic in form of 5M. Micrognathia or retrognathia, small mandible, and macrostomia, wide mouth, and maxillary hypoplasia or zygomatic defect or cheekbone defect, leading to craniofacial abnormalities and increased convexity of the face, leading to mandibulofacial dystosis or craniofacial abnormalities. Give picture like fish-like face, fish-like face. What about the eyes? Medially absent eyelashes with lower eyelid colipoma, and also antimanguloid downward palpebral fissure. Macrotia, this is the ears. Macrotia, this malformed small ears. And there is pre-auricular skin tag and other skeletal abnormalities like what? Cleft palate, and associated also with lower limb anomalies or club feet and abnormal hands. This is the clinical pictures. So the clinical picture: 5M, micrognathia, macrostomia, maxillary hypoplasia, and medially absent eyelashes with colipoma, and macrotia. This is the clinical picture. So this is Treachear Collins syndrome, autosomal dominant, mutation in Treachear Collins F1 gene, and defect in the first and second pharyngeal arches or bronchial arches. It will affect the breathing, hearing, and vision, and will not affect the gross or brain or intellectual functions. What about the diagnosis? How to diagnose Treachear Collins syndrome? By 3 ways: clinically, radiologically, and molecular genes. Clinically, by 5M. Micrognathia, retrognathia, macrostomia, maxillary hypoplasia, and also medially absent eyelashes and colipoma of the eye, and macrotia. This is the clinical diagnosis. Radiological diagnosis, it will be occipitotemporal X-ray. There is defect in the hypoplasia or discontinuity of zygomatic arches or maxillary hypoplasia, mandibular hypoplasia, and stenosis of external auditory canal. This is the radiological diagnosis. And lastly, it will be molecular diagnosis, leading to mutation in Treachear Collins F1 gene. This is how to diagnose Treachear Collins syndrome clinically and radiologically and molecular genetics. What is the prognosis? The prognosis actually generally normal life expectancy. And it's fatal, it's not fatal, and not curable, and how to treat: symptomatic treatment. You have to manage or to make it like reconstruction surgery, and you have to give this patient hearing aids and the speech therapy. Reconstruction surgery, it will improve the speech. So it looks like multidisciplinary team approach management, maybe leading to tracheostomy or gastrostomy. We need orthopedic, and we need hearing loss specialist and psychiatrist. So Treachear Collins syndrome. What is Treachear Collins syndrome? Genetic disorder characterized by defect in the ears and eyes, and also cheekbones and zygomatic bone. And put in your mind, Treachear Collins syndrome, it will be 5M, micrognathia, macrostomia, and maxillary hypoplasia, and medially eyelashes absent and with colipoma, and also macrotia. Skeletal examination or radiological examination, it will be occipitotemporal X-ray defect or hypoplasia or discontinuity of the zygomatic bone, stenosis of external auditory canal. Molecular genetic, it will be leading to genetic mutations in Treachear Collins F1 gene. This is how to diagnose. What is the differential diagnosis? Niger syndrome, Miller syndrome, hemifacial macrosomia syndrome. This is other differential diagnosis of the similar syndrome. What is the prognosis? Generally normal life expectancy and not fatal, non-curable, and treatment, it will be symptomatic, reconstruction surgery and hearing aids and speech therapy. شكرا. سلام عليكم.